Hi, my name is Tiffany Hecht. I'm a pediatrician and I just started at the Community Health Center of the North Country here in Ogdensburg a couple weeks ago, and I'm originally a Montrealer, so I was born and raised in Montreal. I went to residency for pediatrics in Long Island. Afterwards, I spent a few years doing urgent care in Montreal. Then we decided to move to Florida, and then we had a baby, Dr. Patel and we decided to move closer back to home, and we moved to Messina, and here we are. I always wanted to be a doctor. I knew that from a very young age. We even had to do a school project when I was younger, and I wrote, I want to be a doctor and find the cure to cancer and find the cure to allergies. Haven't done that yet, but I wanted to be a pediatrician. I would say probably before going to med school, I realized I had an affinity for interacting with, babies and children and teenagers, and they're very cute. So I like that aspect, and I like being able to connect with kids and, gain their trust and, reassure parents, and that's it. I just always want to be in pediatrics. Yeah, so I like to definitely connect with the child and baby before I start doing, my exam. I always want to make sure that a baby or a child leaves my exam room happy and smiling and not scared. And I also know how to connect pretty well with teenagers. I am able to, gain their trust so that they, tell me, the truth about, what they're going through. And I would say, yes, since I've had a child, I haven't been back in the game for very long since I've had a kid, but I have a newfound appreciation for motherhood and the newborn period and how stressful that can be. Even for two pediatricians, Dr. Patel and I, we were extremely stressed the first, I would say, 6 months, and even now. So we have, a lot of empathy, and we can relate to, even stressing about the very minute things that a parent might think is minute or another doctor might think is minute, but that for us, we understand that it could be very stressful and scary for new parents. The reason why we wanted to work in more of a community health center is because we like the small town vibe. We really like to know our patients and their families, and really, connect with them from when they come in as newborns till maybe until they're teenagers, and really know their family, the parents, and then sometimes even we get to know our patients' children after however many years that they decide to have kids. And we wanted to help people who really needed access to healthcare. Write down all of your questions, in the weeks coming to your appointment, or as you're, the couple of days coming to an appointment, write down your questions so you don't forget. We do have a lot of time, which is another thing I like about working in a community health center. We do have a lot more time to spend with our patients. So if we have to sit here for an hour answering all questions, we're happy to do so. The most satisfying thing about my job is a happy child, a baby or a child who walks out of the room and says, I really liked Dr. Hecht, she was so nice. Or when a mom messages me that their child was very happy to see me and that they want to come back, to ease a child's stress when they're sick, and that they leave this room smiling. I love going for walks with my son outside. Any temperature, any weather, we love to take walks. Most recently, I've been taking him out in a sled and just walking in the snow. I love that. And that's literally it. Can't wait to meet all of you guys and to build up my practice here and meet the community.